Dr. Eunice Gwan-Misia, aka Dr. G. She's a nurse by profession. She has a PhD in nursing, but she's really focusing now a lot on diversity and inclusion consultancy. We know her very well as a philanthropist. She's helping the Delaware community. In fact, the whole of the US now as a philanthropist, providing PPE, especially during this COVID-19 pandemic. She's a certified international life and professional coach, an educator, a published author, and now owns her own company called Unity Solutions, who is actually one of the main groups supporting this initiative. So without further ado, and Dr. Gwan-Misia is also a caregiver safety proponent. So she actually trains people on caregiver safety. So, and she's going to be talking about following up with Tabe's talk on how to actually bring some of these controls home. Over to you. And by the way, let me just point out, I know there's one key question about nebulizers and asthmatics. That question is going to be taken at the end of the talk, okay? Because I think that's a very critical one.
Thank you. Thank you, Dr. I'm trying to get my slides on the screen, and I will thank you for those kind words. Sorry?
We can see the slides.
You can see the slides?
Yes.
Awesome, awesome. Thank you so much, and thank you to all the previous speakers. You all did a phenomenal job. So I hope I can follow in your shoes. So as Dr. Nukuna indicated, I will be talking about, emergency preparedness. And the reason we're really focusing on this is because of way we do life in our community. And we just need to understand some essential tips and strategies of how we can really take care of ourselves and our families as well. Let me just see, my slides are acting up. Give me 1 second. All right, let me just stop sharing for a second, please, and I will come right back at it.
So while Dr. G is doing that, in the interest of time, Dr. Marcel, Dr. Nukuna, do you want to address the asthmatic question? I think Jesse or Celestine, can you just address that question?
Okay, I can speak to that. So sometimes there is a misunderstanding as to when they talk about nebulizer treatment. So there are two parts. Asthmatics can use inhalers, sometimes in the form of steroid inhalers or things like albuterol, Atrovin. You can deliver these inhalers you can use metered dose inhalers. Nobody's saying, you're not really saying you should not use nebulizer treatments, especially for those who are admitted or those who are positive, COVID positive. If you have to use your nebulizers, you can use them, but you have to then realize that you are now airborne, you now are emitting virus that is in smaller particles, lasting in the room or an environment for longer. And therefore, those who are in contact with you should now be using masks like N95 masks. That's what it means. If you have to use a nebulizer, use it. But now you are a different ball player. You're almost being treated as somebody who's undergoing surgery or being suctioned or somebody having CPR. So for those that we treat or admit in the hospital, there are asthmatics who can use metered dose inhaler to control their symptoms without necessarily using nebulizers. If that can work, that's great. If we can add some other medications to help, that's great. But if you cannot, if your symptoms are not controlled, then by all means use your nebulizers, but now realize that you are now a higher transmission, you're now at a higher level of transmitting this COVID if you do have it to other people. Okay. And those around you should also realize that they are more at risk and take appropriate precautions.
And this is from an occupational health perspective, and be aware of the signs you put on the door. So the housekeeper doesn't get in, or the food and nutrition person doesn't get in with just their surgical mask. Put the controls in place. So when you're going to do these procedures, then the primary nurse the respiratory therapists, they know what's going on. They lock that door after it's happened. So, your appropriate PPE would be worn when you're going in, or else we'll have to be removing half of the people from work from that unit.
This is Miss Ba. I just have a thing to say about especially people who are known asthmatics or have a history and have to fill these prescriptions on the outpatient basis. So there is a back order of inhalers and they're reserving it for COVID positive patients. So people who have historically been on these inhalers are now being switched to nebulizers, are now being switched to nebulizers at home if they are not if they are asymptomatic. So you might run into problems filling your inhalers if you're chronically on inhaler, for example, like albuterol. I know the long-term controllers are still available, but you may run into problems filling your albuterol, your short-term controller, if you're not identified as a COVID positive patient. So they're reserving the inhalers for those patients and then who can use them, and nebulize, and everybody else is being switched to nebulizers because that's what's available now. So just so you know, there's a lot of drug shortage and allocation going on, and you might see shifts in how you fill your prescriptions as well from your local pharmacies.
Okay, thank you.
So Ms. Pa's point, if I can clarify, Ms. Pa is actually saying what the current thinking is, that if people are COVID positive, you want to avoid nebulizers. That's why they are reserving the inhalers for the COVID positive patients, so that they are less risk for spreading to the community. Those who do not have COVID are getting their nebulizers. You can use them because then you don't really have anything to spread as far as we know. Correct, Ms. Pa?
Absolutely. Thank you.
So we'll hold on to those questions at the end. I'm sure there'll be many more. Over to you, Dr. G. Thanks for being patient there.
Oh, you're very welcome. All right, so let me just go over the objectives of my presentation. At the end of this presentation, our audience will be able to complete a family emergency plan. They'll be able to list available resources in the community. They'll be able to describe everyday preventative actions, some of which have already been talked about. And also they'll be able to develop a personal self-care plan and identify some risks and barriers that are unique to our immigrant homes. All right, so when we're talking about a family plan or a home plan, you may want to say, well, piece poor planning brings piece poor results. So if you do not have a plan in place, let's just assume we have another surge of COVID-19. So we're better prepared. We have something in place. So what I'm going to talk about is how do you actually get this plan in place, and what are some of the things you need to do? So the first thing we're going to talk about is actually going through the process of developing this plan. And the first thing you want to do is to talk with the people who will be responsible for that plan within your household or within your community. But we're going to focus on the household. So let's say the husband, the wife, the kids, the grandmother, because we know that in most of our homes, we average about 5 to 7 people, right? So there is an elderly person, there is a child, and those are the people that our doctors have identified are those at risk. So who is going to be responsible for what? So you need to sit everybody down and talk about what each person is going to be responsible for, and maybe some other relatives. For example, who is going to, do we have a room in the house where if someone gets infected, we're going to isolate them in that room? Who is going to be responsible for taking their food and their medications to them? Or do we keep those medications in that particular area of the house? Do we even have that area to allocate to that? Those are conversations that you need to have. Then you need to plan ways of caring for that person that's at risk. And the younger kids. How are we going to take care of ourselves and prevent from infecting or cross-contaminating everyone at home? Based on our conversation and some of the research out there, 50 to 70% of immigrants, especially Cameroonian immigrants, are in the healthcare industry. So we're out there in the front lines. So how do we leave home, go to work, and come back and keep our families safe? Tabe mentioned earlier, maybe do one entrance into the home. That entrance means maybe coming through the garage door instead of the main door. And if you choose to do that, then you must bolt your main entrance to the house so somebody doesn't mistakenly go through that door when everybody else is coming through the garage door. And what does that really entail? That entails a lot of things and strategy, putting an infrastructure in place. Number one, you need to make sure that you have extra clothing in that garage because you're bringing your clothing from work. Maybe you did 12 hours. I hope you're not doing any 16-hour shifts. Maybe you just did that. And you're bringing these clothing that is soiled. You don't know what has dropped on your clothing, even though maybe you had your PPE. But now you have to come into the house. So I would recommend that you have maybe a plastic bag or a laundry basket where you're dropping all the clothing from your body that you were just used at work in that basket, on the plastic basket, before you go into your home. Just strip down. Have extra clothing in there you can wear to walk across your house. If your access to your laundry room is right off of your garage, good. Maybe you can just drop them right in the laundry and wash every day. But if you don't have immediate access to your laundry room coming through your garage door, you may want to put them in plastic bags and take them to the area where your laundry room is in your house. Because you're coming in, you have your grandmother, you have your grandfather, maybe your uncle who's elderly, or maybe has comorbidity factors like the asthma, the COPD that has already been talked about. You do not want to put them at risk for getting that infection. You also want to know your neighbors. Who is your neighbor in case you have an emergency? Do you have a neighborhood social media site? If you do, please do not shy away from it. This is not the time to run away from social media. You want to make sure that you're registered on that social media, should in case there's breaking news, should in case there is access to healthcare that you needed and you've lost maybe your numbers on your phone, or maybe you just need some resources in the community. You also want to identify aid organizations in your community. Who is doing what? Who is maybe providing resources in terms of food? You may have a sick individual in the home and you've not been able to get out and go get food, but now you need food and there's no food at home. Know some of those organizations that could deliver food to your front door, that maybe someone could go out and pick up food. There's a lot of areas within our community, especially here in Delaware, and I'm sure it's the same in Pennsylvania and New Jersey. Different organizations are really doing a phenomenal job with distributing food, donating food, so no one should really go hungry, all right? And then you want to make sure that you create an emergency contact list. Make sure it is current. Do not go by what you used to have in your old phone book or in your phone. This emergency contact list must be in a visible area of the home. After you have your meeting, everyone should know where this is going to be posted in the home, whether it's on your refrigerator or it's on your, you have it, but make sure everyone is aware of the location and can quickly identify that. Choose a room in your home that you can use when someone gets sick, and you have to isolate that individual from the rest of the family. I believe it was Tabe or Dr. Nukuna who mentioned earlier, you have to use your mask if you want to go into that room once the person is isolated. Maintaining that 6 feet social distance. We as a community of Cameroonians, we have this culture, and it is nothing of our own doing, but we believe in taking care of our own. This is not the time to be so humble and put yourself at risk to become infected. Yes, dad is there. Yes, mom is there. Yes, your auntie, uncle is there. You want to provide that care to them. But be mindful that you can get infected. You're going out to work, you're a healthcare provider. You're going to take it and put those nurses at risk, and doctors and everyone in the front lines who are also going to go home to their loved ones. You're going to put them at risk. So it's not all about us in our immediate homes. It's also how we can cross-contaminate within the community. And this is not the time for us Cameroonians to be drinking or socializing or going to the actual soup parlor. It is not the time, ladies and gentlemen. This is time to really do some soul searching. Yes, you may miss that drinking. This is a matter of death and life. It is a matter of death and life, and we are going to take it serious. That's why we're on here today. And I applaud you for being here, because we really have to get away from that mindset of, these are my people. I need to touch base. Touch base on the phone, my brothers and sisters. You don't have to hug and be there. Yes, I know we love hugging. This is not the time. COVID has no discrimination. It doesn't care what degrees you have. It does not care who you are in the community. You will get COVID when COVID gets to you. So let us do our own individual parts to really help with flatlining the infectious rate. All right. So you also want to stay home when you're sick.
You guys should go to daddy. You can't come here.
Except you have to get out for medical reasons.
I look great.
Cover your cough.
Mommy.
You're sneezing with tissue. Use your elbow instead of your hands. Clean frequently touch surfaces, your doorknobs that you touch daily, your countertops, your bathrooms. Take care of that.
All right, you guys go to daddy. Let me come, okay, mommy?
Eunice,
I'm attending a class.
Can you
unmute?
Can you mute yourself, please? Whoever has a child there, just mute yourself, please. Thank you.
So we have this plan in place, and we've put it where everybody can see it. Dr. Nukuna already addressed the preventative actions. Hand washing. What I'm going to add to that is, if you can visibly see dirt on your hands, please do not use hand sanitizers. You're not doing yourself a favor by putting hand sanitizer on top of dirt. Use water if you have access to water. Please use soap and water. And make sure you're washing for at least 20 seconds. And when we talk about hand washing, do not wash with your hands up. Wash with hands facing down. Because if you have your hands up, the water is dripping on your arms and to your elbows. Are you going to wash your entire arm? You should really wash up to your mid-arm. But so use at least 20 seconds, hands facing down, with warm water, soap, with some soap. Scrub very well. For those of you who have the artificial nails, you want to make sure you're really scrubbing underneath your nails and in between your fingers. Use one paper towel to dry your hands and a second paper towel to turn the faucet off. And you must wash your hands after you go to the bathroom, before eating, after blowing your nose, coughing and sneezing. So you want to remember that, and also remind your children that make sure they wash. I know my kids, sometimes I have to repeat it over and over. How many times they run right into the bathroom and run right out? You have to ask, did you wash your hands? So we really have to remember that. Even when you bring fruits home from the store, are you washing it before you put it in the refrigerator? Are the kids washing it? I do double. I wash when I bring it, and when they take it, I make them wash it again. Just, you never know. Just like you're bringing shoes from work, you should not be walking with them through the house. You shouldn't even get into your car with those shoes, even though research has said that it is not being transmitted through these means. But you never know. You can walk into the house, your child is crawling, they can touch their hands on the floor. Where does it go? Smack on the face. So that is something to be cognizant of. And if you're using hand sanitizer, it must contain at least 60% alcohol. I know they're homemade hand sanitizers. Just make sure that if you're making it, use at least 60% alcohol in that mix, all right? So the risks and barriers that are unique to our community. We talked about the number of people living in a home. You as a healthcare provider, you're living in that house, you're going to work, you're already stressed by what you're seeing. You're exhausted, you're overwhelmed. When was the last time you saw people dropping like flies? That in itself is traumatizing. But we as a people, we have the stigma about mental health. We're more concerned about what somebody's gonna think of us when we say, I'm overwhelmed, I'm stressed, I'm depressed, I need help. or maybe I'm getting burnt out. We are shy from that. This is not the time, my brothers and sisters. This is the time to take total control of your mental health, of your total holistic well-being, mind, body, and soul, your finances, your relationships. But if your mind is not put together, you cannot make decisions. It's even difficult when things are normal. Right now, we're living in very trying times. So our mental health is very key. But I intentionally wanted to talk about this because of who we are and the stigma we associate with mental health. The first thing we must do, my brothers and sisters, is this. Recognize in terms of your stress that you may be experiencing, and feel free to talk about it. Control your well-being. Don't let others control it by what they say. You have no control what they're gonna say. They will say it, but it's okay. Talk to people that will help you. You are in control. You're the captain of your health at this point. So recognizing those symptoms and the fact that you are stressed, talk about it. Discuss it with whom? Your immediate supervisor at work, your husband, your wife at home, your children at home if they're of the age that they can understand. You need to know that stress-related disorders can lead to more health issues. We just heard our doctors vividly and clearly talked about comorbidity factors. You do not want to put yourself in a health situation that you cannot come out of because you're concerned of what A and B is going to say. You're concerned that they're going to say, oh, you're depressed because you're lazy, or you're stressed out because you don't have support. We are here to support you, if nobody else. This team that has been put together is here to lead you to the right resources. Do not shy away. So some of the things you need to do is talk it over with your coworkers if you don't have anyone at home to talk about. Identify those things that are bringing up the stress to you. Is it home-related issues? Is it work-related issues? Are you eating right, like Dr. Massa said? Are you sleeping at least 6 to 8 hours? Make time for some healthy meals. Maybe you might need to do some meal prepping ahead of time so that stress is not playing a factor when you come in and you're exhausted and you can meal. Take breaks, my dear brothers and sisters. During your shift, that job has many people doing that same job. You are not the lion of that environment. You're human, and it's okay to step back and say, I am overwhelmed. I cannot do this right now. May I take a few minutes? Step back, go into your break room, go somewhere, maybe in the bathroom, and just pull that mask off your nose to breathe. Because we all know, the doctors can agree with me, that you can potentially go into carbon dioxide if you're wearing the mask 12 hours, 16 hours without a break. So just stop. Nobody's gonna say you're not a good employee. This is not the time. Take care of you. You are in total control. Make sure you're stretching. Take that time to stretch. Check in with your supportive colleagues and friends and family. One of the things that I will say for us to do from a mental health perspective is that we should take a break from social media regarding COVID-19 updates, breaking news, how many people are dying. The last time I watched, there were 10,000 people that have died just in the United States. I have not watched it since yesterday and today because I choose not to, because I realized that it was starting to really put such a heavy burden on my heart, seeing how many people were dying. So just take a break from social media, go back at it, and you can keep looking at it. When you are away from work, exercise, spend time outdoors. And the doctors can correct me on this. I looked on the news. Us as Black people, African Americans, Cameroonians, from the Black race, we tend to run low on vitamin D. We're at home so long now that we need to get some of that natural vitamin D. And if you do not know your levels, please, my brothers and sisters, talk to your doctors and get checked. Check your levels so you can make informed decisions, knowing exactly what your levels are. They're saying most of the patients in our ICUs on the vent, especially from our race, were found that they were low in vitamin D, or they were on the low normal end of vitamin D. Also, make sure you're taking your vitamin C. So I wanted to kind of highlight some resources that are in the community. This all came from cdc.org. Please, we are home. It is not a matter of saying we do this, but it can happen. Suicide prevention, domestic violence, disaster within our homes. We are living in close quarters right now with people that we're used to everyone going to work and coming home in the evening and sitting down for dinner. But you're spending 24 hours with everyone at home. We can get on each other's nerves. But the sad part is sometimes things can get out of control. But these are things that we do not talk about in our communities, but we need to. There is resources. You don't have to call a Cameroonian. You can reach out to any of these numbers and get help if you're experiencing any of these things. Domestic violence, suicide precaution, or what have you. And then we have COVID-19 resources. Tabe already talked about the NOSH workplace safety, and we have CDC COVID-19. So it's cdc.gov/info, and it will link you to all of these resources that I just talked about. Our Lieutenant Governor, who happens to be a nurse, Dr. Bethany Hall Long, is a big advocate for mental health. Tomorrow, she is hosting a conversation about the effects of COVID-19 in the Black community. I encourage each and every one of us to sign up to attend this Zoom conference tomorrow, because there are things on there that we can potentially learn about. There are resources in the community. We live here in Delaware, New Jersey, Pennsylvania. We pay taxes in these states. So any of the benefits or resources that we can lay our hands on to help our families, let us take advantage of that. If you have some mental health issues and you don't want to talk to a Cameroonian, reach out to people like Dr. Bethany Hall Long, because she will lead you in the right path. She has resources in the community. Your congresswomen, your Secretary of Health, Dr. Walker, these are people, resources that we can have. And Najela, if you can actually type in the chat room the website to go in and register for this event, it is Lieutenant Governor, which is ltgov.questions@delaware.gov. So please take advantage of that. We have a lot in our community that we can fall back to. Were you able to get that, Dr. Nakuna? Okay.
Yes.
It's ltgov.questions@delaware.gov.
Yeah, I got that. Thank you.
Thank you so much. So with that said, that was my little note in a nutshell about mental health. Now, we're talking about us as healthcare professionals, taking care of family, going out there in the front line and taking care of others. My brothers and sisters, ladies and gentlemen, we cannot take care of others if we haven't taken care of us. So you must take care of you and have a plan in place. Maybe you had a plan prior to COVID-19. Maybe you did not. Now is the time to reinvent the wheel and say, hey, let me go back and really think about me. Because if your mind, body, and soul is not together, you're not able to give to others. Or if your cup of love is not full, you cannot give somebody else love. Because I believe as a nurse for 22 years, that when I step out and step into my patient's room, I must bring positive energy to that patient. And when I don't have the positive energy, my patient's outcome could be something else, especially during these times of COVID-19. You're now the patient's advocate. You're now the patient's power of attorney. The only difference is your name is not on that power of attorney paperwork or the living will. So that is a lot that you're taking on you. You're wearing so many hats. So to take care of yourself should be priority. It's essential. It's very crucial. So when we talk about self-care, we're talking about your maintenance, which is what you do every day on a daily basis. something you value and you choose to do, whether it's exercise, whether it's eating right, whether it's just simply going into your prayer closet and just crying out your lungs out. It is how you want to spend your time. That is your self-care. Then you have your emergency. Did you have one prior to COVID-19? Are you gonna have one when there's a surge? You need to have one. And that is identifying strategies that you can implement when and if you face a crisis. And I have to remind us that self-care plan is not a one-size-fits-all. But what is one factor is the commitment to follow through with what you have written down, is the commitment on a daily basis to do what you said you were gonna do. So if you wanna know about how you do your self-care plan, these are some of the steps you need to develop your self-care plan. Number one, you've identified you need one. How are you coping right now? What are some of those coping mechanisms or strategies or techniques that you're using to cope with your stress and you're feeling overwhelmed or depressed or feeling even burnt out? What are you doing now that has been working for you? What do you do right now? What does your family do? What are some self-practices that you need to continue and which ones do you need to eliminate? It is all up here, my brothers and sisters. It is your mindset. Once you've identified this, you know, we are fond of community living, but that sometimes information that is not necessarily good for you is what often people remember more. So deal with your mindset and only allow in your brain what is going to be fruitful and yield you good results. And then ask yourself, am I ready to do the work? It is just not writing a plan and putting it on your refrigerator or in your bathroom and then never do anything about it. What do you really stand for when it comes to your health? We've all been told health is wealth, right? So what do you stand for when it comes to your life, your patient's life, your family's life? If you do not stand for something, guess what? You will fall through with anything. So put your mask on first. All of us have been on an airplane. When the air hostess comes out and says when they're doing the emergency drill, what do they say to you? Put your oxygen on first in case of an emergency before you put your neighbors or whoever else you can help. So it is very essential that you put your mask on first, put your own oxygen first, then you can give what you have left over to others. You will be in total well-being and then you can help other people. And it is okay again to take a step back, think it over and make that personal commitment to own your self-care because you deserve it. Not only that, you deserve more. Once you're completed with this plan, you need to share it. I believe in accountability, and Dr. Nukuna Najala will tell you, you have to have an accountability partner. Why? Because somebody who will tell you what you do not want to hear necessarily. Somebody who will direct you in the right path, not somebody who would intentionally want to set you to fail. And that's who you should have in your tribe. At eUnity Solutions, we believe that it takes a village to raise a child. The village of our Tri-State Pandemic Task Force is helping to raise our community. But we cannot do the job if we all do not have the buy-in. So share those plans with your family, with your friends, with your colleagues, so they can hold you accountable when you face those roadblocks that life throws at us at times. Because it will happen. Just follow through with your plan. So that is all I have. And if there's anyone on this call as a Cameroonian or know of any healthcare professionals who are struggling with having PPEs, particularly masks, whether it's surgical or homemade mask, we at eUnity are able to give out some surgical masks. So if you need masks or you know someone who is taking care of a dad or mom at home and do not have that, please let us know. All you need to do is go on our website at eunitysolutions.com and request a mask, and it shall be on its way to you. because we consider you essential. We consider you, we love you. We do not want you to get infected. We are very fortunate at this time that we haven't had any of, death in the immediate community in Delaware from this, as far as I know. So we just need to really commit ourselves and follow through with everything that we've talked today. And if you need more information, I'm sure the panelists and the speakers will be glad to share our slides. But one thing I will bring to our attention before I close is, according to Delaware Online, as of Friday, Black and Hispanic Delawareans are infected with COVID-19 at a drastically higher rate than white residents. Among the Black population, 60.1 for every 10,000 people are infected in the Black community. In the Hispanic community is 46.1 per 10,000 people and 13.9 per 10,000 of white Delawareans. And this was the very first data since COVID-19 started that has to really speak about a lot of the minority population here in Delaware. So more than 50% of the labs that are really doing the testing, they were not asking questions about your race or ethnicity. So our governor, John Carney, is now requiring that data on every test kit. So Delaware does not even know the race of about 25% of the total number of confirmed cases. And for those of our brothers and sisters that live in the Newcastle area, the governor, as of Friday, said that more testing will focus on the Newcastle County Route 9 corridor, because this population have limited access to health care. So if any of our brothers and sisters are within this corridor, please get tested if you haven't already. It just gives you a more peace of mind and kind of decrease that anxiety that we all have, especially when you're out there in the front lines working. So that is really it for me. And I'd like to thank our team, the pandemic task force, for the opportunity to be of service to our community. Thank you again. And I hope we continue to have a good time and more discussions. Thank you so much.
Thank you, Dr. G, for such a riveting conversation. I know there are lots of action items following your call, so lots of resources that we have to share. I think one thing that stood out for me was really some of the issues about stigma, so maybe we'll have a chance to talk about this at the end of this talk. But let me go ahead and introduce Nkam Mongwa from the Southern Jersey area.